What is epilepsy and seizure? How do I know if I have epilepsy? If I am being diagnosed with epilepsy, what are the precautions I have to follow in my life? Whether epilepsy is curable, what the treatment options I have, whether I can lead a normal life, can I marry, can I be pregnant in later life? These are the questions being asked to our practice by the patients we are treating. Hello and welcome. Myself, Dr. Subhayan Mandal. Considering all these questionnaires, I am giving my medical dossier, which is pertinent in this epilepsy awareness program. First of the thing is, what is the epilepsy and seizure? Know that the term epilepsy is derived from the Greek word epilepsia, that means taking hold or being seized. Now, seizure or epileptic seizure is the clinical manifestation of an abnormal, excessive, and hypersynchronous electrical discharge of a population of cortical neurons. Whereas the epilepsy is a brain disorder which is being characterized by recurrent seizures that are unprovoked by systemic and neurological insult. So, there is a difference between the seizure or epileptic seizure and the epilepsy. And from there, these two things, we can derive that seizure could be two types. It could be acute provoked seizure that happens in the context of an acute brain insult or systemic disorder, such as but not limited to stroke, head trauma, a toxic or metabolic insult, or an intracranial infections. One that occurs in the absence of an acute provoking event comprises the unprovoked seizure. It is to be noted that, however, there may be history of stroke, trauma, etc., but at the time of the event, neither were present acutely. Epilepsy is furthermore being classified and expanded in its definition as the conceptual definition of epilepsy and operational definition of epilepsy. Conceptual definition of epilepsy tells that it is a disorder of the brain characterized by an enduring predisposition to generate epileptic seizure and by the neurobiologic, cognitive, and psychological and social consequences of this condition. The definition of epilepsy therefore requires the occurrence of at least one epileptic seizure, whereas the operational definition comprises of 1. At least 2 unprovoked or reflex seizures occurring more than 24 hours apart, or 1 unprovoked or reflex seizure with a probability of further seizures similar to the general recurrence risk of at least 60% after 2 unprovoked seizures occurring over the next 10 years, or and diagnosis of an epilepsy syndrome to get incorporated into the operational definition of epilepsy. Therefore, epilepsy is considered to be resolved for individuals past the applicable age of an age-dependent epilepsy syndrome, or those who have remained seizure-free for past 10 years with no seizure medication for the past 5 years. So, this is the expanded definition of epilepsy, and therefore it has been classified in the two types, that is conceptual definition and operational definition, which I have described before. Now, how do I know that I am suffering from epilepsy? One could know about his or her illness by analyzing or actuation of the description of symptomatology to a medical practitioner, or symptomology being analyzed or critically described to the medico by one's family member or caregiver. General symptomatology of epilepsy are alteration of level of consciousness or responsiveness, motor manifestation, duration of event and recovery, the patient and witness assessment of functioning afterwards, that is particularly focal symptoms, incontinence, mouth or tongue bite, muscle soreness, and if there is any family history, if being present, that increases the likelihood of epilepsy. Now you require examination and critical consultation, specialized consultation by a medical expert before you being diagnosed to be epileptic or having seizure. Now, the practitioner usually use one electrophysiological test, that could be EEG, one imaging, that may be the MRI or CT of the brain, and some biochemistry based on the semiology or the ictal event that has been happened before. That could be the prolactin level, CPK enzyme, blood electrolyte sugar level, and the toxic screen. Now, if the epilepsy is being diagnosed, what are the precautions one need to follow? First thing is that do not get worried. Second, you consult with your family physician. 5. If you are being advised to take AED, take the AED regularly. Have a good sleep. Avoid taking beverage. Avoid walks requiring climbing to a height. Cover the sharp edges in the domestic environment so that you are not being hurt if you are being getting unconscious during the ictal events. Take consultation of epileptologist, neurologist, that is specialized consultation thereafter, and psychiatrist if you are suffering from the mental problems. Consult with your licensing authority if you have a active driving license and you are driving regularly. For pregnant women, for women in the childbearing age, counsel once a year beside consultation with a gynecologist. If you are being asked that whether the epilepsy is being curable, I used to state, as per the medical dossier that is being published till now, is that some epilepsies are curable. Example, benign epilepsy with centrotemporal spikes that are being usually controlled after the puberty or in puberty. Control ictus in the setting of a normal MRI brain epilepsy protocol, who is on regular medications with 4 EEGs done at regular interval, usually at 6 months interval, showing normal result, can be withdrawn from the antiepileptic drug after 2 years. Note, there are some epilepsies which may not be controlled throughout the life or may require very long term to get control, even having normal MRI of brain, namely the juvenile myoclonic epilepsies. Syndromatic epilepsies are probably not curable, however can be controlled with medications. Secondary seizure disorders are very difficult to control because you are harboring some lesions in the brain, some abnormalities in the brain, which are very difficult to normalize with the medication or by the surgery or by the available treatment options you have. Predictors of outcome therefore determined by the age of onset, the type of epilepsy, MRI findings, number of medications needed to control, and education of the patient and caregivers, which is very much important, and regularity of the medications used. Now, what are the treatment options you have? Treatment options, the armamentarium to treat the epilepsy can be classified or in the following manner, that is one is medical therapy, another is surgical therapy, and there are some other therapies. Now, medical therapies consisting of the different medications, narrow spectrum, broad spectrum antiepileptic drugs. For example, levetiracetam sodium valproate is a broad spectrum drug, and also the lamotrigine. Narrow spectrum drugs are carbamazepine, oxcarbazepine, etc. The surgical therapy could be temporal lobectomy, amygdalohippocamectomy, lesionectomy, hemispherectomy, corpus callosotomy, and dietary modification in adjunct to the medication sometimes being used in resistant cases. And you note that it is very old, since 1921, and characterized by the fasting, acidosis and ketosis to promote the formation of the ketone body within the body. It was first described by the Sina and Kossoff in 2005 scientifically, although it is being practiced long before, since 1921, that is 1921. Now, therefore, the ketogenic diet composed of a very low carbohydrate diet, high fat diet, low to adequate protein, and carbohydrate only comprising of 5 to 10 gram per day of the diet, whereas the fat and protein ratio could vary from 2:1 to 4:1. The mechanism of dietary modification to treat the epilepsy is unknown, but it is being used. In others, the other therapeutic armamentarium could be the vagal nerve stimulation, which is being used and employed since 1997. It could be trigeminal nerve stimulation, or it could be repetitive transcranial magnetic stimulation, and last but not the least is the radiosurgery. If you consider the success rate of different therapeutics, medical therapy has an overall success rate of about 80 to sometimes 68%. So the chance of recurrence is being described in different literatures to be between 20 to 32%. But the surgical therapy overall has a success rate of 58% in 12 years. Dietary therapeutics have the success rate of about 30% in adjunct with the other medications. The stimulation, that is vagal nerve stimulation, trigeminal stimulation, repetitive transcranial magnetic stimulation, has an overall success rate of about something between 40.5% to about high as 68%. Now the radiosurgery has an overall success rate of about 52%. Now, whether a patient suffering from epilepsy can marry and can have children if he is suffering from epilepsy? Yes, it is one of epilepsy patient can marry and have children even he or she is suffering from epilepsy. In men, the concern are less. Some important medical dossier in this relation to epilepsy are that is approximately 1/3 of the women with epilepsy, especially those with focal and perhaps temporal lobe seizure, report increased seizure rate shortly before menstruation or ovulation, causing it to be as a catamenial seizure, and most probably due to the hormonal influence. If this is happening, you have to adjust the dose. Some AED are teratogenic due to the either oxidative injury or folate deficiency or due to both. Here you have to choose the AED wisely. You have to give 4 mg to 5 mg of folate daily. Measure AED level in blood regularly during pregnancy or on every 1 to 3 months basis if you are getting pregnant when you are taking the medicines. Vitamin K supplementation at the rate of 10 to 20 mg per day is sometimes required for mother taking enzymes inducing medication, namely the carbamazepine, phenytoin, phenobarbital, primidone, etc. You have to consult with the gynecologist for planning safe pregnancy and have a healthy baby at the last. Chance of epilepsy in the baby depends on the genetic epilepsy syndrome, namely the juvenile myoclonic epilepsy, Dravet syndrome, which happens due to the SCN1A mutation, and childhood absence epilepsy, which is usually due to the GABA mutation. And if being present in her first sibling, there is an increased chance of having this syndromatic epilepsy in the next children. What one should do if not able to tolerate the anti-seizure medications? And intolerance to the anti-seizure medication is being described in literature about 7 to as high as 22 to 30%. The cause could be due to the minor and transitory. Here only the assurance is enough. It could be minor and long durational, where you have to adjust the dose, and if you are suffering from side effects, that is jaundice, abdominal bloating with raised LFT, you have to change the medications. So with this, I want to conclude the session of my discussion, and I wish that you all enjoy this small discussion, my medical dossier, my attitude in treating the epilepsy, and I hope that the people who are listening, they can brought with them different new ideas, and then they can, if he is a doctor or he is going to be a doctor, they can employ this simple methodology and simple medical dossiers in their practice. It, thank you all for seeing this video, and thank you before ending this session.